Hello, back again with another episode of Real Health Talk with Dr. Coring. My name is Dr. Coring. For those who do not know me, I am a board certified internal medicine physician who is now training in hematology and oncology to become a hematologist and oncologist. And it is my absolute pleasure to discuss various health topics with the hopes and the goals to educate common folks such as yourself regarding various health topics, basically to increase health literacy in order to improve wellness. That's what I like to do, that's my passion. And today, the topic I would like to discuss is politics, particularly how politics can affect your health. Specifically, today is November 6, 2024, and we have a new president. The 47th president, Donald Trump, was elected president based on the electoral vote. And so, President elect 47, there's some controversy around Donald Trump, specifically back in 2022. And regarding women's rights. And so, if you don't remember, there was a law basically passed by the Supreme Court in 1973 called Roe versus Wade. This was a landmark decision by the U.S. Supreme Court in which the court ruled that the Constitution of the United States protects a woman essentially from any excessive government restrictions regarding abortion. And so essentially it supports the woman's liberty to choose to have an abortion without any excessive governmental restrictions. This was actually decided in 1973. However, in 2022, the states overturned Roe versus Wade. And essentially that created controversy, so much so that people are, I guess concerned, that would be the best word, of this president's-elect stance on women's health and abortion, which is a fair concern. And so that's what I would like to talk about. And so I want to spend some time for the next episodes basically discussing Donald Trump's stance on various health topics. And today we will discuss his stance on the health topic of women's rights and abortion. And so on his campaign trail, this is the things that he said he would do, and these are the promises that he made. And so let's start there. He said that he would basically be a champion for women. This is what he said. However, he did say that he would reimpose many anti-abortion policies of his first administration, basically including restrictions on the Title 10 family planning program and the global HIV programs. And so these are the things that he said, he would reimpose. And so let's back up. So reimposing restrictions on the Title 10 family planning program. Let's talk about that. So the Title 10 family program was basically established in the 70s. And this is a program that was enacted by Congress. Basically, it's a public health service program. And it's a federal program to essentially ensure that family planning and related preventative health services were being optimized. And in doing so, the Title 10 family program became a critical part of America's public health safety net. It was a point of entry for care for millions of people, pretty much low-income people. And so the low-income population was able to take advantage and is able to take advantage of the Title 10 family program by providing good quality care, affordable care in regards to family planning. So what does that mean? Well, the type of care they were providing was a broad range of medical services that were approved by the government. So contraceptive services, so birth control was part of these services. Natural family planning methods was also part of these services. Preventing pregnancy was the main goal of these services, and also preventing sexual transmitted infections. That was also services that were provided. And so there expect restrictions on these types of services. And so these services restrictions were basically provided during his first administration. And so there are plans to reimpose some restrictions on this program. And also global HIV programs. There were also restrictions on these programs during his first term, and expect the same. And let's talk about that briefly. So the global HIV program is an initiative initiated by essentially the WHO, the World Health Organization. And the whole goal of this program is to essentially reach a HIV elimination in certain states, certain areas of the country, of the world, by 2030. Basically, by delivering good quality, affordable HIV services, including preventive services as well. And so, that being said, expect some restrictions there. That affects women's health tremendously because preventing HIV essentially helps, help women family plan, so to speak. And so, if a woman has HIV, that can affect family planning and also the neonate and the infant. It affects the infant negatively if there's HIV that's hard to prevent, and so that should be something that you can expect, and also expect Trump to give some government support for in vitro fertilization and other reproductive health services. That's what he said. He's promised to be a champion for women, so expect him to do that. He said he would actually give some support for in vitro fertilization and other reproductive health services. So obviously it's clear that President-elect 47 is pro-life, and also he is against abortion. And so anything that affects pro-life, in vitro fertilization, and other reproductive services, you probably will get the support there. And he's going to be a champion for women in that regard. And things that are related to abortion and aborting pregnancy, expect not a lot of support. From his mouth, he said vetoing, overturning Roe versus Wade is enough at the federal level. And so there may be some more restrictions at the state level. And let's talk about what he won't do. This was mentioned along the campaign trail as well. And so he said he would not enforce the Comstock Act. And what is that? So the Comstock Act was an 1873 law banning essentially the shipping of lewd items, including drugs and instruments used for abortion. And so banning these types of items can obviously prevent the act and the actual carrying out of the abortion. And so he said he will not enforce this act or this law. And that was said in August of this year. And so he said he has no plans to enforce the Comstock Act. Also, he said he will not enforce a national abortion ban. And so he said that basically he would not support, he pledged that he would not support or he would not veto a national abortion ban if that were ever to reach his desk. And so he said he won't do that. So what is the bottom line? What are the concerns? What are the fears? Well, I'll tell you. The consensus is that women, not just women, but people in general fear that because the SBA Pro-Life of America poured in tens and millions of dollars into Trump's campaign, as well as other Republicans, that he may feel an obligation to essentially curtail access to abortions. And so the fear here is that his administration, he may appoint judges as well that can curtail access to procedures without even passing any legislation because he may feel compelled to do so because of the support that he was given. Also, there is fear that he may appoint hardline anti-abortion officials in key positions that works for Health and Human Services, HHS, the Federal Drug Agency or Administration, the FDA, and the Justice Department. Basically, these people, there are certain people at these agencies that have an agenda, anti-abortion agenda, and so there's fear that because he's been getting a lot of support, monetary support from anti-abortion groups and organizations, that this support may mean that he may put people in positions to carry out certain agendas, anti-abortion agendas. And so that way, he may not get his hands dirty with it, but he may put people in positions to dirty their hands. And lastly, there's fear that there may be some steps to block access to nationwide drugs that account for more than 2/3 of the U.S. abortions. And so that goes in hand with putting people in position that maybe work at the FDA, that have the actual power to block this type of access or change laws, state laws, essentially to prevent this type of medication from being accessible or easily accessible. And so, there's concern, because he has allies, conservative allies, at the Heritage Foundation Project, the 2025 Project, and other groups. We talked about the SBA Pro-Life of America group as well. So there's various amounts of allies, anti-abortion agenda allies that Trump has that supported him throughout his campaign that he may feel an obligation to. And so these are the fears. This is, a good synopsis, or at least a summary of what he said he will do, what he said he will not do, and some basically deducing and assessing that, drawing some valid concerns regarding women's health, regarding this new President-elect 47, which is Donald Trump, and also the new regime that you can expect to accompany him in his presidency. So that's my time, guys. I love you guys. Like and subscribe. And yeah, catch me next time on another episode of Real Health Talk with Dr. Corey. Peace.